What do you want? What, you want to go outside? Well, let's go. Come on. Oh. Okay, come on. Okay, back to what I was saying. Figure I'll show you the bump first. 28 weeks. 28 weeks has also brought me a couple nice beauty marks here. It's going pretty well. What is up, guys? Welcome back to my channel. I'm Jordan, and here I'm sharing my journey through pregnancy into motherhood. So I am 28 weeks today. Today's topic, I feel like we just have to cover this to kind of progress into where I want to take my further videos. And today we're talking all about interventions during labor. I feel like I have to cover this. One, because I said I would in my previous video, and two, just because it'll kind of give you guys an understanding of where my thinking is at as we go along into my other videos. I'm gonna keep my opinion out of it and just do the best to stick to the facts. All this information is from books or documentary, and one of the books is like written by a doctor, one is written by a midwife, so they're well-versed, well-experienced resources. I will link all my resources that I use below just so you can look further into it. I don't want you to take my word as fact, although these are true. I would have come to know and what I've learned since becoming pregnant. So if you don't have time, I mean, you can trust me, I'm not gonna lead you astray, but this video is just really to start some critical thinking in your brain, start the process of research and figure out what's best for you, and help you figure out, are these interventions and the risks of them worth it? Now, we are thankful to have modern medicine, and we are thankful to have these interventions because things do go astray in pregnancy, and we're glad to have them because they can be life-saving measures. But I'm talking about these from a 100% normal, healthy pregnancy, going into labor, healthy, no complications type of situation, where a lot of these things would more than likely cause like a hindrance or cause more problems than what they're worth. So I'll leave that for you to decide, and I'm just gonna kind of talk and go through each one, the risks, and how if you start one type of intervention, it can quickly topple in to another, or two, or three, or four, or next thing you know, you had this idea of what birth would be like, and then it was completely snowballed into this traumatic experience. I do want to say it's not medical advice. This is just me reviewing to you what I have learned throughout my pregnancy journey. Always consult your doctors, ask them questions about these things, see what they answer you. I don't know what that will be, but doctors like interventions, so yeah. So let's just jump right on into it. So you're going about your business, you start feeling contractions, you get kind of excited, oh, this is it. Just know that labor can start and stop a few times before it actually turns into active labor, so watch that. Also, I would just say, do not be I know it's like an exciting time and you're like, oh, I gotta get to the hospital, or oh, I gotta get to the birth center. Like there's a rush to do something, but labor is generally a long process, hours long. So my advice to anybody would, do not show up to the hospital super early. In the hospital, once you get to the hospital, essentially whether it's said or not, you're put on a timer. Clock's ticking. They want you to have that baby within 12, 24 hours. Like servers, they want to turn the table, like get you in, get you out, we got another person. That's how businesses make money. medical field is a business, and I think people forget that. Do not go to the hospital too early. That's just my opinion. Like I said, not medical advice. Now we'll drop my opinions and move on forward. Okay, one more opinion. If you do have a hospital birth, you're going to check into labor and delivery, and there's going to be these waivers. I would ask your provider, if you're going that route, to see these waivers and see them and read over them before you're actually in labor, because you're not going to want to read over it and you're just going to willy-nilly sign. Well, the medical field considers this your informed consent. This is consenting to anything that can happen from now on. Ask for that prior to going into labor so you can read over it and decide from there, and not just sign your life away, essentially, you know, like the terms and conditions on our iPhones, because this is a situation where you should, you know, have respect for your body and just know what's going on and the reasons why and the steps and all that. That's just my second advice and opinion there. And now we're gonna drop all of those and just move on to the facts. First intervention that I want you to do is bed rest and lay on your back, be bed bound. And this is counteractive to labor. This increases your chance of poor contractions. It can slow down your dilation, your effacement. It has potential to cause low blood pressure in mama, which then lessens oxygen to baby. It can increase your pain. Also, giving birth in this position on your back, laying down, is the worst position physically for your body to give birth in, just due to the mechanics of the pelvis, and that sacrum kind of blocks it. This is, however, the best position for the doctor to catch your baby. This is why this is the standard position in the hospital to give birth. So it's not for mama, it's for the provider. The next one is fetal monitoring in a normal, healthy pregnancy. This is not necessary. It's not been scientifically proven to help or hurt. A lot of times fetal monitoring can actually increase your risk of C-section due to maybe you moved or something and it giving a false reading on your baby, and that scares doctors because they're liable, and then they say, oh well, baby's in distress, let's get you snip snap snap cut up. That's just a risk of that. It increases your risk of C-section. Fetal monitoring makes you be in that bed rest, laying on your back. All the birth stories that I've heard is people prefer to be moving because it can be very uncomfortable to be stuck laying on your back. Another thing is having frequent vaginal exams to check your dilation. The more you have, the more risk of infection you have, the more chance you have to get that group B strep. The vagina is a self-cleansing organ, but as you're putting, you know, fingers and opening that unnecessarily, you just have the risk of getting an infection that way. Also, the antibiotics for the group beta strep that you would have to be on if you were to get that can cause a risk, a higher chance of asthma and allergies in the baby. Another intervention is the hospital not allowing food and water, and this can make your contractions weaker or less effective. Your body's going through like an event, so it's a physical activity, just like anything before sports or something of the nature. You're gonna want to be nourished. Food is nourishment, food is energy, and when you take that food and water away, it's gonna weaken after time, especially since you're in labor for hours. The next one we have is IV fluids. IV fluids can slow your contractions because they are diluting your blood. So your blood is rich in oxygen and rich in the nutrients that go throughout your body, and when your body is in labor, it produces the hormone. Well, just think, if you're putting IV fluids in your blood, you're diluting that oxygenated blood to the baby, and you're diluting that hormone that's supposed to get your body to contract and continue on with labor. In normal natural labor, there is no need at all for an IV. The only reason there is a need is if you decide to get an epidural, but a risk of having an epidural is mama getting low blood pressure. And to increase that, they do IV fluids to increase your blood pressure. You're in the hospital, labor is not moving along, your water hasn't broke, and then they say, well, let's just break your water. This is only proven to speed your labor up 30 to 40 minutes. The risks of this is that your body knows what you need when you need it. A lot of times when the water breaks, it doesn't all come out at once. I mean, sometimes it can, and if your body's ready for that, great. But a lot of times it can be leaking for so long that your body like slowly getting the baby to put pressure, you know, on your cervix to open and dilate and all that. When they premature break the water, then you're putting pressure on that baby's body that it wasn't ready for because it's going to empty it. And then when your uterus contracts and all that, it put premature pressure on your baby. You're on that time clock. Remember, things aren't happening as quickly as they would want them to. Let's start you on Pitocin. Let's speed things up. Let's get this baby going. Let's get this baby out. It sounds fun and dandy. No. Okay, sorry, that's my opinion. We'll drop those from here. So Pitocin, I'm sure you guys have all heard it. This forces your uterus to contract, and it forces your uterus to contract stronger and faster than a normal contraction. So this is going to increase your risk of pain since it is doing this so quick and your body doesn't have the natural normal recovery time from the contraction, because contractions are planned out where they contract and then you have a little bit of rest and then they contract again. If your body's not having that natural amount of time to relax, then this can cause your baby distress because your uterus contracting so much and not resting enough decreases the oxygen to your baby. Your baby is breathing through your blood. The placenta is carrying that to your baby. When your uterus contracts more frequently than normal, it's a risk that your baby won't get as much oxygen to their blood, which then increases your risk of baby being at distress. The pain also increases your risk to, maybe you decided you didn't want an epidural, or you decided you didn't want pain medicine. You're increasing your risk of the epidural and IV because of how painful it is. Pitocin also increases your C-section rate just because of the distress of the baby. You do have to be on the heart monitor when you do Pitocin just to watch how the baby's responding. Next intervention that you have an option for is IV pain medicine. You think, oh, I don't want the epidural, but maybe some IV pain medicine. Just know, no drug is 100% safe. The blood-brain barrier in the body isn't fully formed until I think like 25 years. The placenta does carry those drugs to your baby. Maybe it's safe as they're not gonna die from it, but all drugs have a risk no matter what the drug is. I mean, go watch a TV commercial about a drug and you're gonna have, this drug is great, here's all the side effects, baby death. Yeah, just think about it. The most common IV pain meds that they would use is Fetal or Fetal. When the baby's born, this can cause depression of breathing in the newborn, less responsiveness, so the baby's not gonna be as alert, so they're not gonna really want to nurse. They're going to be sleepy when they're born. They're just going to be more tired. The IV pain meds have been detected in infants' blood after birth for weeks. So if that doesn't tell you that it does get to them, it does. And then also, pain medicine can affect the mom's ability to bear down and push. It can cause the mom potentially to not push as effectively, to be weaker in that area. In the pushing stage, your body will naturally, from what I've listened to in the hundreds of birth stories that I've listened to, your body, when it's time to push, your body tells you to push. And with those drugs in your system, it can just weaken that ability to push or to know to push. A lot of people do the Pitocin and then they're in so much pain, they get the epidural, which relaxes you, relaxes your body, makes you kind of numb, not be able to feel it. So you have that Pitocin that's really contracting, and then you have that epidural, which is relaxing, and it's kind of like they're working against each other, which both of those together can cause the baby distress. When you have an epidural, the mom's at risk of getting a fever. You have to have the IV because of the risk of low blood pressure, which then gets less oxygen to your baby. When you get an epidural, obviously, like it blocks your feeling. This will affect your pushing as well. You potentially won't be able to push as effectively and your pushes will be weaker. Both of the IV and the epidural use increase your risk of having a vacuum or forceps delivery, an assisted delivery, just because those muscles aren't pushing as well as they could. Doc's gonna say, we need assistance, let's get this baby out. A vacuum and forceps both risk the traction damage to your baby. The body's naturally supposed to push your baby out. Your baby's supposed to come out by a force behind them and not a force pulling them. This traction can cause damage to your baby's head, neck, spine, all that. So if you have a vacuum or forceps delivery, personally, I would go see a baby chiropractor. The risk of a vacuum, your baby could potentially have a cone head, and then forceps can cause bruising on your baby's head, and it can also have potential to paralyze a facial nerve of your baby. And then the last one I'm just gonna briefly talk about is an episiotomy. So the baby's head is coming out. These used to be routine back in the day until they started to get proven not a good thing, an episiotomy. And so that's when the surgeon, the OB, makes a lateral cut, like from your vagina towards your leg, and to give the baby more space to come out. I don't know about you, but that just sounds real painful to me. It's said that that kind of cut is even worse than a tear, just because it's painful, it's longer healing time than a natural tear. It just sounds no bueno. Not for me. So yeah, guys, so those are the most common interventions during labor, and those are the summed up versions of the risks of each of those that I've brought to the table. There's a lot more information that I didn't cover on that, but I hope I gave you just a brief idea and a spark to, hey, maybe this is something I need to look further into. Or maybe you're done having kids. Maybe you didn't know these things. And maybe you do know someone who's pregnant and is on the fence about these things, or they're pregnant and they want these things, but they don't know the risks. Share it to them. Just help get them thinking about what is best for them and their body. Just have the knowledge, the empowerment to know and decide, because you have a choice in your medical care no matter what. You can always refuse something, and you can always make the best choice for you. So I hope this was really informative, and I hope you learned something. I hope it gave you encouragement to go do some research. And if not, if you're not a reader, if you don't have time to read, or you don't have time to look up anything, I just hope that you got something out of this. If you like this video and like the information I provided, give it a thumbs up. If you want to support me and support my channel, go ahead and click subscribe, and don't forget to press that bell so you don't miss a thing. I'll be back next week, and I can't wait to see you there. Bye.